Good morning. We're going to get started with diabetes, insulin, and the Epi-Pen. This is our annual training. So we're going to start with a video. It's about 15 minutes long, and then I'll be lecturing about diabetes. So here's the video.
Hello, I'm Dr. Stephen Lemaski, Chairman of the Diabetes and Endocrine Disease Management Committee at South Nassau Communities Hospital. If you're watching this video, you're probably one of nearly 25 million Americans with diabetes or a friend or family member of one. The numbers are staggering. Based on data from the 2011 National Diabetes Fact Sheet from the American Diabetes Association, 18.8 million people have been diagnosed with diabetes. About 7 million people have been undiagnosed, and nearly 79 million people have pre-diabetes. In fact, 1.9 million new cases of diabetes were diagnosed in people aged 20 and older in 2010. So you're not alone. Diabetes is an important disease that can lead to serious vascular complications. Medically, we divide them into small and large vessel problems known as micro and macrovascular disease. These are the problems that can affect your eyes, kidneys, nerves, and of course can lead to heart attacks, strokes, and amputations. By learning about diabetes and managing it properly, you can limit or prevent these complications. In this video, we'll teach you about the basics of diabetes self-management. You'll learn about creating a diabetes care plan and what it should include. A panel of experts, including a nurse, a pharmacist, a physical therapist, a dietitian, and a diabetic educator, is standing by waiting to answer your questions. And always remember, you can live a long and full life with diabetes, but it's ultimately a self-managed disease, and it's all up to you. So let's get started. In this section, we'll learn what diabetes is and why it occurs in some people and not others. Our first patient question is for our nurse manager.
What is diabetes and why does it happen?
Diabetes is a condition that causes high sugar levels in your blood. When you have diabetes, your pancreas does not make insulin, or it does not make enough insulin, or your body prevents the insulin you do make from working right. As a result, sugar can't get into your cells, so it stays in your blood. That's why your blood sugar gets too high. Diabetes can cause problems, but diabetes-related problems don't have to happen. Millions of people live long, full lives with diabetes. You can be one of them. Taking care of yourself and your blood sugar is the key.
I feel so alone. Who's going to help me with all this?
I understand your concern. You are not alone when it comes to managing your diabetes. You may have a team of healthcare professionals working with you. You may also have family members or friends for help and support. But the most important member of the team is you. As the captain of your team, you need to learn as much as you can about diabetes in general, know as much as possible about your diabetes and your health.
What's in a diabetic care plan?
Your diabetes care plan should include a meal plan, a physical activity plan, a plan for how often you should check your blood sugar, your personal blood sugar goals, when to take your diabetic medications, a schedule for regular checkups, and any other health goals you may have.
What's going to be in my schedule?
I'm glad you asked that question. Your schedule should include the following. On a daily basis, check your blood sugar as recommended by your diabetes care team. Every 3 months, regular office visits are very important. Your A1C test is needed to be done if blood sugar is not stable. Blood pressure checks should be done, weight checks, as well as foot checks. Then every 6 months, an A1C test should be done if your blood sugar is stable, and also dental exams are needed. Every year you should receive a physical exam. Also, a comprehensive foot exam is very important. Test for blood fats and cholesterol every year, or more often if you're not at your goal. Kidney tests, dilated eye exams, and also a flu shot is extremely important for you as well.
Why do I have to check my blood sugar?
I'm glad you asked. Checking your blood sugar yourself is often the best way to be sure your diabetes is under control. It tells you the following: if your insulin or other diabetic medications are working, and how your physical activity and the foods you eat affect your blood sugar. So based on your care plan, you may want to test when you wake up, before meals or large snacks, 1 or 2 hours after meals or large snacks, before and 15 minutes after physical activity. We recommend you keep a blood diary to track your blood sugar.
What should my blood sugar levels be?
Your A1C should be less than 7%. Before meals, it should be 70 to 130. 2 hours after meals, it should be less than 180.
What's an A1C test?
The A1C test measures your average blood glucose control for the past 2 to 3 months. It does not replace daily self-testing of blood glucose.
Excellent questions. In this next section, we'll learn about insulin and how diabetics use it in their care plan.
What about insulin?
People with type 1 diabetes must take insulin to control blood sugar. People with type 2 diabetes who take insulin may find that they have more flexible eating and activity schedules. The different types of insulin are rapid-acting, which controls blood sugar surges at mealtime, long-acting, which controls blood sugar between meals and during sleep. Premixed combines rapid-acting and intermediate-acting insulin, which controls blood sugar at mealtime and all day and night.
What is an insulin plan?
Your plan will help you take insulin the way your body would make it if you did not have diabetes. Your plan tells you what type of insulin to take, how much insulin to take, and when to take insulin. Your plan is based on when and how much you eat, your current blood sugar level, your level of physical activity, and your lifestyle.
How and where do I inject insulin?
You inject insulin using an insulin pen, a syringe filled from a bottle of insulin, or an insulin pump. The locations where you inject insulin are the abdomen, thighs, or backs of the upper arms.
Okay, but how do I store the insulin?
To store insulin, you should follow the instructions on the insulin label, keep unopened insulin containers in the refrigerator, keep insulin out of bright light and sunlight, do not use insulin after the expiration date on the label, and it's usually okay to store insulin at room temperature once it's been opened, but check the label to make sure. And don't let insulin become too hot or cold.
I see, but how do I get rid of the used diabetes supplies?
You should use needles and syringes only once, then throw them away in a safe container. Find out if your state has laws about how to dispose of used diabetes supplies. Unless your state says otherwise, get a Sharps container at your local pharmacy. Ask your diabetes team how to get rid of the container after it's full.
Our next section covers the importance of exercise and how to start an activities or exercise program.
How do I start an activity program?
That's an excellent question. First, talk with your doctor before you start any exercise activities. Then choose your activity, whatever is comfortable for you. Perhaps walking or jogging, bicycling, swimming, or even dancing. Then set a goal for yourself. Your goal should be at least 30 minutes of activity at least 5 days a week.
Proper activity is so important for people with diabetes. Next, we'll tackle how to prepare a healthy diabetes meal plan.
How do I plan healthy meals?
For teenagers and adults, a day's worth of healthy meals includes at least 2 to 3 servings of non-starchy vegetables, 2 servings of fruits, 6 servings of grains, beans, or starchy vegetables, 2 servings of low-fat or fat-free milk, and about 6 ounces of meat or meat substitutes. Eating a healthy diet can help you control your blood sugars and blood fats, help you maintain a healthy weight or lose weight if you're overweight, and allow you to take less medications or avoid taking medications for your diabetes.
What about carbohydrates and why are they important?
Good question. Carbs raise blood sugar more than other nutrients and are found in a lot of foods. Carb counting can help you manage your blood sugar, be flexible in your choice of foods and meal times, and eat more foods that you enjoy. The only foods that generally do not contain carbs are meats and meat substitutes such as eggs and cheese, and fats and oils. Look at food labels to see how many carbs are in your favorite foods. Remember to choose your carbs wisely.
How do I use exchange lists for meal planning?
Each list has foods that have about the same amount of carbs, calories, protein, and fat. The lists come in these groups: starch, fruits, milk, sweets, desserts, and other carbohydrates, non-starchy vegetables, meat and meat substitutes, and fats. It's important to eat not only the right types of foods, but also the right amounts. Weigh and measure your foods when you first start carb counting and once in a while after that. Use your hand to estimate portion sizes. Your fist is about 1 cup. Your palm is about 3 ounces. Your thumb is about 2 tablespoons or 1 ounce. Your thumb tip is about 1 teaspoon. And a handful is about 2 ounces or 1/4 cup of a snack food.
Now let's learn how to handle low blood sugar and understand the potential long-term health issues for diabetics.
My first question for you is, how do I manage low blood sugar?
First, recognize the symptoms: weakness, tiredness, hunger, dizziness or shakiness, nervousness, sweating, fast heartbeat, or blurry vision. If you are experiencing any of these symptoms, eat or drink something high in sugar right away, such as 4 ounces of regular fruit juice or soda pop, 3 to 4 glucose tablets, or 3 to 5 hard candies that you can chew quickly. If your blood sugar is too high, you may feel very thirsty or hungry, need to pass urine more than usual, feel like your mouth and skin are dry, have blurry vision, or feel sleepy. You can manage high blood sugar by checking your blood sugar, following your meal plan, doing your prescribed exercises, and taking your medicine as prescribed.
What else should I do?
Make sure you know when and how to take your insulin or diabetes medicine, when and how to check your blood sugar and what the numbers mean, and how to call your diabetes care team. Know your target blood sugar goals before meals, after meals, and your A1C. Make sure you know what you can do if your blood sugars are out of range. Make sure you know how to follow your meal and exercise plans.
Great, thank you. But what about long-term health problems?
Over time, high blood sugars can cause problems with your heart and blood vessels, your kidneys, teeth, gums, feet, eyes, nerves, or your skin. To help prevent these problems, keep your blood sugar as close to normal as possible. That means following your diabetes care plan.
Hello again. I hope that you enjoyed watching this short educational film about diabetes. We hope that you now understand what diabetes is and how it can be controlled. Most importantly, I want to remind you that the care and treatment of people with diabetes should be individualized. We are all unique and different. With the help of your doctors, nurses, pharmacists, dietitians, and other members of your healthcare team, you should be able to create your own diabetes care plan. And now you know what it should include. It's important to stay in good control. Mark Twain once wrote that good judgment comes from experience, and experience comes from bad judgment. Diabetes is a disease that requires your lifelong commitment, so enjoy the journey and keep on learning. South Nassau Communities Hospital and the Diabetes and Endocrine Disease Management Committee would like to gratefully acknowledge the Shlomo and Cindy Sylvian Foundation whose generous grant provided the funding for the production of this video.
So I'll be lecturing about diabetes for a little bit here. So diabetes, the normal blood sugar runs from 70 to 120. If the blood sugar goes less than 70, this is considered low blood sugar. This is hypoglycemia. The causes of low blood sugar can be too little food, too much insulin or diabetes medications, as well as extra activity. This can come on very suddenly, and it can progress to what's known as insulin shock, and it can lead to seizures and even death. So the signs and symptoms that someone's blood sugar may be running low can include shaking, fast heartbeat, sweating, dizziness, anxiety, hunger, impaired vision, weakness and fatigue, headache, irritability. What you're going to do is if you notice that something is off with your diabetic client, or it just doesn't, you notice any of these signs and symptoms, you're going to go ahead and take a finger stick blood sugar, see what the level is at. If it's less than 70, you're going to go ahead and give something fast acting with sugar, a small glass of orange juice, glucose tablets if you have that available, soft pieces of candy that they can chew and swallow quickly. You want something fast acting with sugar. You're then going to wait about 15 minutes and retest the finger stick blood sugar again. If it's still less than 70, you're going to repeat that process, give them something else fast acting with sugar, wait 15 minutes and retest again. The level really should go up from there, but if the person is no longer alert and oriented, perhaps they're no longer responding to you, you're going to go ahead and call 911. When in doubt, ship them out. That's one of my favorite sayings. If you are uncomfortable with the situation in any way, go ahead and call 911. We'll talk more about that in a minute, but first let's talk about high blood sugar, hyperglycemia. This is a blood sugar above 120. This can go all the way up to 400 and beyond. The causes here of high blood sugar can be too much food or the wrong kinds of food, too little insulin or diabetes medications. Perhaps they need to be started on metformin or glyburide or even insulin to take down those high blood sugar levels. Also, illness and stress. Illness and stress can certainly impact blood sugar levels. During periods of change, you probably want to watch for either low blood sugar or high blood sugar. So high blood sugar goes on over time. Over time, it will take its toll on the organs of the body. There'll be damage to the eye, the heart, the extremities, the kidneys. It's not usually considered something that requires a prompt intervention or a medical emergency like with low blood sugar, but it can be. So the signs and symptoms of high blood sugar are the three main symptoms here. They're always hungry, they're always thirsty, and they're always running to the bathroom to urinate. Other symptoms, they can have dry skin, slow healing wounds, slow healing infections, drowsiness, blurry vision. So you'll have it written in your MAR as well as your doctor's order what number to actually call the doctor at. It should say something like call the doctor on call if the finger stick blood sugar level is above 400 or 450. If you do call the doctor on call, they're probably going to ask, is the person alert and oriented? What's going on with this person right now? If they seem completely fine, the doctor might say, have them drink some water, exercise if they're able, and retest again maybe in an hour to see if it's gone down. But of course, you're going to go based upon what the doctor told you to say in that case. They may tell you to call 911 and have them shipped to the hospital. So now this is actually just an example of how low blood sugar can drop very quickly. This will look different for everybody, but this is just an example. So mild hypoglycemia, let's say this is a blood sugar level of 60. At this point, you'd be starting to see sudden hunger, headache, shaking, faster pounding heartbeat. They could be sweaty, tired, dizzy, have blurry vision. They may be nervous or excited, drowsy, have numbness or tingling around the mouth and lips. If it's not treated with something fast acting with sugar, it can progress quickly to moderate hypoglycemia. Now this could be a blood sugar level, let's say, of 50. Now you could be starting to see personality change, irritability, confusion, poor coordination, difficulty concentrating, slurred or slow speech. If it's still not treated with something fast acting with sugar, it can progress to severe hypoglycemia. Let's say this is now a blood sugar level of 30. At this point, the person could actually start seizing, having seizures, and they could even pass away. So this is why it's so important that you're able to recognize those signs and symptoms of mild hypoglycemia. The anxiety, the shaking, the sweating, the hunger, it seems to come out of nowhere. So you're able to act, take a finger stick blood sugar, see where the level is at, and treat it accordingly so you can stop it from progressing to a true emergency like severe hypoglycemia. I'm going to show you a video about how to take a finger stick blood sugar level, and then we can talk more about that.
Many Canadians need to test their blood sugar levels every day. This video will show you how to prepare to test your blood sugar level, lance your finger and draw blood for testing, and use your blood sugar meter. Part 1. Preparing to test your blood sugar level. To test your blood sugar level, you will need a blood sugar meter, a test strip, be sure to check the expiry date, a lancing device, a lancet, cotton balls or tissues, a sharps container. This can be obtained from your pharmacy. It allows you to safely dispose of needles as they should never be thrown in the trash. Before you test your blood sugar, wash your hands with soap and water or use hand sanitizer. Prepare the lancing device. For most lancing devices, you will need to remove the device cap by twisting it off, insert a lancet into the holder, twist off the protective disc, replace the device cap, and adjust the depth setting. Smaller numbers are for shallower punctures. You may want to start at a shallower puncture and increase the depth if you cannot obtain a sufficient blood sample. You may need to load the lancing device by pressing or sliding the control button until you hear a click. Insert a test strip into the meter. Lancing your finger. Choose a spot to lance your finger. Using the side of the fingertip may be less painful than the pads. Use the lancing device to lance your fingertip by holding it in place and pressing the release button. You may want to stabilize your hand by placing it on a flat surface. Gently massage your finger in the direction of your fingertip until a round drop of blood appears. If the blood smears or runs, do not use the sample. Instead, dry the area and gently squeeze for another drop of blood. Touch and hold the test strip opening to the blood drop until it has absorbed enough blood to begin the test. Part 3. Using your blood sugar meter. You can view your blood sugar results on the meter screen. You may want to write the result in a blood sugar diary. Then, using the advice and plan given to you by your healthcare team, take the proper steps to treat your blood sugar if it is high or low. You have now completed the blood sugar test. To remove the lancet from your device, you need to remove the lancing device cap, place the lancet protective cover on a hard surface, and push the lancet into it. Eject the lancet by sliding the ejection button forward until it pops out. Replace the lancing device cap. Dispose of the lancet and test strip in a sharps container. This video has shown you how to prepare to test your blood sugar level, lance your finger and draw blood for testing, and use your blood sugar meter.
Okay, so I happen to have the same exact meter that they have there in the video. The meter that you're using may be a little bit different, but they all sort of have the same concept. You have this container that contains the test strip. You take a test strip out of the container, and you put your test strip into the meter, and then it comes on automatically and it says apply blood. Now at this point, in this device, you actually have to load a needle into the device, and then you twist off and there is an exposed needle. Be very careful and aware of what you're doing when working with needles. You are at risk of bloodborne pathogens, hepatitis B, hepatitis C, and HIV. Be very, very careful. And if the person is supposed to be taking care of their supplies by themselves, you want to let them do that. Don't put yourself at risk of a finger stick blood injury if you don't have to. So if it's in their plan that they're supposed to be taking care of their own supplies, definitely let them do that. So at this point, the cap goes back on, and you're going to have the person wash their hands with soap and water or use an alcohol swab, wipe the side of the finger, and you're going to put this right against the site that you cleaned, press that white button, and the needle's going to pop out against the skin. If you get a sample on your first attempt, the first drop of blood that you get is not considered an accurate reading. It actually has broken capillaries from the puncture. So you want to wipe that and dispose of it. The second drop of blood that you get is what you actually want to put onto that strip right there, and then it will give you a number. Let's say it says 49. Is that high or low? Low. What would you do?
Give them one, sugar,
Yeah, so you would give them something fast acting with sugar, wait 15 minutes, and then you would test the finger stick blood sugar again. If it's still less than 70, you're going to go ahead and give them something else fast acting with sugar, wait another 15 minutes and retest again. If the level doesn't go up at that point, and they stop being alert and oriented, or they're confused, or you're feeling uncomfortable, you're going to go ahead and call 911 or seek advice from somebody else. Let's say it says 170. Is that high or low? That's high. It's higher than the level of 70 to 120, but it's probably not high enough to call the doctor or anybody on call. In that case, I would just document that. And what's going to happen over time is that documentation is going to go to their next appointment, and the doctor makes a decision at the appointment should the person be started on metformin or glyburide or even insulin. Let's say it says 450. Is that high or low? That's very high. So in that case, you probably would be calling the doctor on call and seeking advice from there. So at this point, so this has blood on it, so you can take this out and put that into the sharps container. At this point, you have a used needle. So this can go on a flat surface like a table. That needle can go straight into the plastic piece, and then you slide this forward and the needle pops out, and this goes into the sharps container. I have seen the needles pop out of the sides of these before, so I wouldn't be too trusting. Be careful about where you're putting your fingers, and always pay attention to when working with any sort of needle. Be very, very careful. Questions or comments about this? All right, we're actually going to talk about a diabetic diet, what somebody with diabetes should and should not be eating, or what they may want to avoid. So a diabetic diet. A diabetic diet is mainly a low carbohydrate diet. It contains of your nuts, your eggs, your dairy products. Some fruits and vegetables are considered better choices than others. With the fruits, usually the berries are considered better choices. Blackberries, blueberries, strawberries, raspberries, those are better choices than the fruits that contain a lot of natural sugar. Apples, bananas, oranges, peaches, pears, those have a lot of natural sugar and can definitely raise the blood sugar level. The vegetables, usually the greener vegetables are considered better choices. Green beans, zucchini, broccoli, lettuce, spinach, those are better choices than the starchy vegetables. The starchy three that you either want to avoid or have small portions of are peas, carrots, and corn. Those are the starchy vegetables. Also, beets should be added to that as well. A lot of the low-carb choices, unfortunately, are high in saturated fat as well as salt. For example, hot dogs, bacon, and sausage. These have little to no carbohydrates in them. They're not going to immediately raise your blood sugar level. But if somebody's eating something like sausage all the time because they think this is a good choice for their diabetes, they are intaking a lot of saturated fat as well as a lot of salt, and that could lead to circulatory problems with the heart in the future. So you want to be sure that person is not being overloaded with too much salt or saturated fat. Now the bad foods, the high carbohydrate foods, of course, this is all the comfort food, the fried food, the sweets, the desserts. Perhaps some of the choices are surprising to you: bread, rice, pasta, certain condiments like salad dressings, especially if you're really loaded on, that can certainly be high carbohydrate, like the Thousand Island dressing, for example, which I love. Ketchup, especially when you consider portion control, barbecue sauce, honey, jelly. So they have all of these low-carb choices at the grocery stores nowadays, but just because a label is indicating to you in some way that it's healthy, maybe it says something like no sugar added, it doesn't actually mean that it's low carbohydrate, especially when you consider portion control. So it's all about moderation, portion control. You want to get good at reading labels and paying attention to what the serving size is and what the person is eating and how it's actually impacting their blood sugar level. This is very much an individualized process. One person with diabetes may be able to have a couple slices of pizza and it not put them up to 300. The next person may not. So pay attention to what the person is eating and how it's actually impacting their blood sugar levels. So now the ABCs of diabetes, A stands for A1C, which is a blood test that shows what your average blood sugar level has been during the past few months. So that will be a blood test that they will be having done. B stands for blood pressure. If you have diabetes, controlling your blood pressure is just as important as controlling your blood sugar. High blood pressure puts you at risk for heart attack, strokes, and kidney disease. And C stands for cholesterol, which is a waxy substance found in the blood. High cholesterol is another factor that increases your risk of heart attack, strokes, and other serious problems. So why are these ABCs so important? People with diabetes are 2 to 3 times more likely to have heart attack or stroke, which can occur at younger ages and can be more severe and more deadly. If blood sugar levels are always running high, this could lead to eye disease, which can lead to vision loss or blindness, kidney disease, and with end-stage kidney disease, they may need to be put on what's called dialysis, where they have to go to the hospital a couple times a week and have the toxins filtered out of their blood. The kidneys are no longer doing this for them. As well as nerve damage called neuropathy, which can cause numbness or pain in the hands and feet. This can be downright painful, and there may have the need to have amputations of the toes, fingers, and other body parts. So they're aiming for an A1C below 7%, blood pressure below 140/90 or lower in some cases, and an LDL cholesterol, L is the lousy cholesterol, below 100. So what the person should be doing every day, they should be taking their prescribed medications, eating a diet low in saturated fat and cholesterol, but rich in fruits and vegetables and low-fat dairy products. Limit the amount of salt and saturated fat that they're intaking. Be active, lose weight if they're overweight, and avoid alcohol. You also want to look at this person as far as education goes. They have the right to refuse their diabetic diet, their diabetic treatment, their medications. If their blood sugar was 300 and they wanted to have a piece of chocolate cake, they have the right to have that piece of chocolate cake. Is this within their best interest? No, it is certainly not. But are they aware of the long-term effects caused by high blood sugar levels over time, the damage to the eyes, the kidneys, the nerves, the extremities? Perhaps they're not. And what is the best way to teach this person? Would they learn best through video, written material? Is there a certain way that you need to speak so that they're actually understanding what you're saying? Your staff meetings are a great time to come together and talk about this. I do this training usually twice a month, and sometimes I've had clients come in just to sit in and learn about diabetes, and they're always more than welcome to attend if you know one that may want to. So now we're going to talk about the feet. This is a very important topic with diabetes. Some possible foot problems. They can have nerve damage, which can have unusual sensations in the feet and legs, pain, burning, numbness, tingling, and fatigue. Skin changes, excessive skin dryness, scaling, and cracking. This may indicate that circulation is compromised. Deformities, their toes can actually take on a claw toe-like appearance. Prevention is key here. You want to prevent foot problems with diabetes. If they are a smoker, it's best if they quit. That will help with circulation. Avoid activities that can injure the feet. You don't want them walking around the house barefoot or anywhere barefoot because they have a loss of sensation. They may not feel if they stepped on something sharp. A couple of little stories. One was of a man walking outside on a hot summer day, kind of like today. He was walking outside barefoot. He had a type 2 diabetes. He had a loss of sensation in his feet. He didn't feel that both of his feet were being burned, so he continued to walk on the tar barefoot. This led to second-degree burns in both feet, which blistered, opened, became infected. Both feet ended up being amputated. That could have been prevented by wearing sandals or protective footgear when walking on the tar. And whose responsibility do you think it is to prompt them to wear sandals or protective footgear?
Ours.
Yeah, it's the staff's. They have the right to refuse, but this all has to go into documentation. What did you say? Did you teach? And what was their response? So you definitely want to prompt them and document what they said and what you said. Another story was of a man who walking around the house barefoot. He got a splinter in his big toe, which became infected. The infection spread all the way up the leg, and the leg had to be amputated. So that could have been prevented again by wearing something on the feet when walking around the house. And you definitely want to prompt them to do that. You don't want them going into the bathtub without testing the temperature first. If it was scalding hot, they may not feel that they're being burnt, so always test the temperature of the bathtub water. You want to look at the feet here and there. The best way that I can recommend to do this is put it in the MAR as a treatment. I know one agency where they call it Foot Friday. It's right in the treatment in the MAR at 8 p.m. That CRNA will look at the person's feet. and they'll document any findings. That way it's actually prompting the staff to do it, and you have documentation as to who the last staff member was to have their eyes on those feet. So socks and shoes, not too tight, not too loose. And they will be meeting with the podiatrist, which is the foot doctor. They will be the only person to trim their toenails. Do not trim the toenails of somebody with diabetes. If you do, if you accidentally nick them on the side of the toe, then you'll become infected, which could lead to an amputation. You don't want to be the one responsible for that. So the foot doctor will be the only person to trim their toenails. Questions or comments so far? So we're going to take a minute and do this little review on the very last page here. I'm actually going to read the question, and you can feel free to shout out the answer if you think you know it. So number 1, the resident that you're caring for has a blood sugar level of 60. After giving her a glass of orange juice, what is your next step? What do you think? So it would be B, wait 15 to 20 minutes and test the glucose level again. If you had her lie down and checked on her in 2 hours, she could have passed away for all you know. She had low blood sugar, she needed to be monitored. And giving her an extra dose of insulin, the action of insulin is actually to reduce blood sugar. So if her blood sugar was already low at 60 and you gave her insulin on top of that, that could actually kill her. That would not be a good choice. Number 2, which of the following is not one of the main symptoms seen in diabetes? Yes, it would be slow healing cuts and bruises that most likely you would be seeing. The other 3 choices here, extreme thirst, excessive urination, and extreme hunger, those are the 3 main symptoms of high blood sugar. Number 3, which of the following is not typically a symptom seen in hypoglycemia, low blood sugar? Yes, it would be D, mental sharpness. It would actually be confusion or mental sluggishness that most likely you would be seeing. The other 3 symptoms here, anxiety, shaking, and hunger, those are the 3 main symptoms of low blood sugar. Number 4, which of the following is not an example of a good low glycemic food? B. Yes, corn is a very starchy vegetable which you either want to avoid or have small portions of. The other 3 choices here, eggs, almonds, and tuna, those have little to no carbohydrates in them. They're not going to immediately raise the blood sugar level. Number 5, which of the following blood sugars is within the normal range? C. Yes, 88 is within the range of 70 to 120. 270 is high, probably not high enough to call the doctor unless you've had other concerns at that point. And 49 is low, that would require you to give something fast acting with sugar, wait 15 minutes and retest again. Number 6, which of the following is not a recommended lifestyle choice to keep diabetes under control? B. C. So this would be C. You want to be sure that they're not being overloaded with too much salt or saturated fat, which unfortunately a lot of the low-carb choices do contain. And number 7, true or false, eye disease, kidney disease, and nerve damage can be long-term effects caused by uncontrolled diabetes. That is absolutely true. So we're going to actually switch topics here. We're going to be talking about insulin. So insulin is one of the injectables that a CRMA can give. It's for diabetes. It's sort of a last resort when it comes to diabetes management. In a residential care facility, usually they use the insulin pen. So if you've been in healthcare a long time, you may have seen insulin from a vial where you have to take a needle, put air into the vial, turn it upside down, and draw up your insulin. That still does exist, but you're way less likely to make a medication error using the insulin pen, so insurances cover it a lot more nowadays. So you get multiple uses out of the one pen. The pen that is in current use can be left at room temperature. Any backup supply pens would need to be refrigerated. You always want to write on the pen with either a sticker or a Sharpie, the date, the time, and your initials that it was first used. And this is important because it actually expires 27 days after its very first use. So you want everybody on the same page as when it was used for the first time. So I'm going to show you a little video talking about the insulin pen, and then we can talk a little bit more about it.
An insulin pen is a device that allows you to give insulin. Your diabetes medical provider and diabetes educator will let you know if your child is able to use an insulin pen. Each insulin pen device works slightly differently, so please follow the pen manufacturer's instructions carefully for use. First, clean the rubber stopper on the end of the insulin pen with an alcohol pad. Next, remove protective tab from back of the pen needle. Press the needle onto the end of the pen and twist to the right until it is tight. Now, clean the site with an alcohol pad and let dry. Prime the pen needle by dialing the pen to 2 units. Holding the pen with the needle upright, push the button all the way down, making certain that the dose dial returns to 0. You should see a stream or squirt of insulin from the needle tip. If not, repeat the previous step. Dial your correct dose of insulin. Follow the directions given to you by your diabetes educator on whether you will need to pinch up the skin for the injection. Next, inject the needle straight into the skin and push the button with your thumb. Make sure all of the insulin was injected. Count for 10 seconds before removing needle from skin. Make sure all the insulin was injected by confirming you see a 0 in the dose dial window. If slight bleeding or stinging occurs, you may apply slight pressure. Do not rub the injection area, as this may cause insulin to be absorbed too quickly. Remove the pen needle after each use and discard into a sharps container. Following these steps and repeat practice will make you a proficient insulin giver. But if you have any questions at all, please consult your diabetes educator or medical provider.
Okay, so the insulin pen. How to use this is you always take this blue piece off. You're always going to wipe this area with an alcohol swab to get rid of any bacteria that might be present, and then you apply a needle by twisting it on. You pull off this plastic piece, and then you have to do what's called priming your pen. To prime your pen, there's some numbers here, and the bottom here slides. You click to the 2, press the bottom of the pen, and you should see some insulin pour out of the needle. That's called priming the pen. If you don't prime your pen, you will be injecting your client with a little bit of air. That can be uncomfortable, and you're also not giving the right dose. You'll be off a couple of units with your dose. So always prime your pen every single time you apply a new needle, which is every single dose. After you have primed your pen, you just click to whatever unit was prescribed to be given at that time. Perhaps it was 20. You would click to 20, and now you're going to give your dose of insulin. Insulin injection sites, the abdomen is actually the best absorption site for insulin. You want to stay at least 2 inches away from the belly button. Another really popular site is the upper outer arm. You want a place with fat to absorb the insulin, so this would be a good place right here, whereas this is mostly a bone and muscle. That would not be a good place, so you want a place with fat. If the client wanted to, they could also do the buttocks or the upper outer thigh, but most often it is the abdomen or the upper outer arm. So what you're going to do is wipe the area with an alcohol swab, let it dry for a few seconds. You're going to have the numbers facing you because you want to watch it go down to 0. Go straight into the site that you clean, press the bottom of the pen, watch it go down to 0. Once it's at 0, count to 10 to be sure they're receiving the full contents of the dose, release, and you've given your dose of insulin. So at this point, you have a used needle. Some of the sharps containers, you can actually walk right up to them at this point, twist, and the needle would fall right into the sharps container. If you have that special container, you definitely want to utilize that. Don't put yourself at risk of an injury if you don't have to. But if you don't have that special container, this plastic piece that you took off in the beginning can go on a flat surface like a table, and you can stick that needle right into there. Just be careful about where you're putting your fingers, twist, and then this would go into the sharps container. Now, side effects of insulin. The number 1 side effect of insulin is actually low blood sugar, hypoglycemia. You actually want to watch for that during periods of change, if they were newly started on insulin, if the doctor just increased their dose of insulin or started them on a different kind of insulin. You definitely want to watch for those signs and symptoms of low blood sugar. The anxiety, shaking, sweating, hunger seems to come out of nowhere. So there are different types of insulin. There's rapid acting, there's short-term acting, intermediate, and long-term acting. Whatever type of insulin that you're giving, the most important thing to know about it is known as the peak time, P-E-A-K, the peak time. This is when insulin is working at its greatest. If insulin is working at its greatest, what do you think the concern here might be? Does anybody want to guess? hypoglycemia, low blood sugar. For example, the rapid-acting insulins, the Humalog and the Novolog, they begin to work 15 minutes after you give them, and they peak around 30 minutes after you give them. So if you gave some Novolog at 9 a.m., at 9:30 a.m., they are most likely to have those signs and symptoms of low blood sugar. The anxiety, shaking, sweating seems to come out of nowhere. So you definitely want to be aware of that. Hypoglycemia is the number one side effect of insulin, so always be on the lookout for that. So, questions or comments about insulin? Okay, we're going to switch topics altogether. We've talked about diabetes, we've talked about insulin, which can be used to treat diabetes. Now we're going to talk about the Epi-Pen, which is an injectable emergency medication for allergies or anaphylaxis. So the Epi-Pen looks like this. So this is an emergency injectable medication. I'm going to show you 2 videos about this, and then we can talk more about it.
Can I have a piece? Mm-hmm. Try it. It's really good. Anthony, can you go help?
In all my years as a licensed paramedic working on the street, not many acute illnesses are as scary as a severe allergic reaction. We have a fancy word to call that. It's called anaphylaxis, which is the body's reaction to something that is causing them to have a number of different symptoms that could lead to a life-threatening emergency. In this scenario, we're going to teach you what anaphylaxis is, what it's doing in the body, and then how we may be able to treat them until emergency medical services arrive. So what is anaphylaxis? Anaphylaxis is an allergic reaction where the body does a couple different things at the same exact time. While the blood vessels are dilating and becoming leaky, allowing fluid to leak out into the tissues of the body, decreasing the blood pressure, something else is tightening, and it's the airways. The bronchioles, the alveoli sacs are filling with mucus and fluids, and basically we have these 2 mechanisms working together to create a serious life-threatening problem. So the signs that this person might be showing is not only the itchy, the hives, the scratchy, the itchy throat, the swollen tongue, the swollen lips. Those are all kind of superficial as far as the outside of the body, but what is happening inside is what we hear most of the time, and that's difficulty breathing, wheezing, gasping for breath, and not able to get it in. This is caused by those bronchial constrictions, as well as the fact that she might be feeling lightheaded and looking pale because her heart rate is trying to increase, and she's also losing blood pressure. So these are some things that we're going to be aware of as we're dealing with this anaphylactic patient. Now in this scenario though, she was wise. She understands that she's having a problem, and she told somebody who was a bystander to go get help. In this training scenario, she's already been prescribed epinephrine for these types of emergencies, but in this case didn't know she had a food allergy. So her brother shared the candy bar with her. It might have had an allergen in it, obviously it did, and now she's reacting to it. So as soon as we could, we got to her Epi-Pen. A few points to think about here is we need to make sure that the date is still within the expiration range so that it's good. We're going to pull the cap off, the safety cap, and it's important to remember that we grip it firmly in our hand, but we do not put a thumb over the needle area or over the back of the Epi-Pen. Now that this has been readied, I'm going to hand it to this victim who's now going to auto-inject. She puts it into her big muscle in her thigh and holds it there for 3 seconds. She now takes it out of her leg and lays it beside her. While she does that, she massages the leg and tries to get the medicine to absorb into that deep intermuscular injection. This training is based on the Epi-Pen brand, so if you use a different brand, make sure you follow that manufacturer's directions. Now, while we're letting that get into the system, if we have not already called 911, we should be. So if you have a phone, dial 911 and get emergency medical services on the way. If you don't have a phone, send somebody to go call 911 immediately. If there's a delay in emergency medical services of greater than 5 to 10 minutes, and the patient actually has a second auto-injector available, we can actually deliver a second auto-injector if the signs and symptoms of her anaphylaxis have not improved. Now, we're always going to be monitoring this patient for an increased problem, maybe a loss of consciousness, increased difficulty of breathing, or respiratory arrest, and then eventually cardiac arrest. And we're going to treat them accordingly while we wait for EMS to arrive.
I'm allergic to nuts. I can eat strawberries. Milk doesn't like me. Mommy says I got an allergy. I get all red and bumpy. My eyes get puffy like this. I don't breathe so good. My tongue gets itchy. It made me really scared. This is my Epi-Pen. 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 My Epi-Pen. Take it out of the case and pop off the cap. Make a fist like this. Like this. Kids like me sit on laps. Bigger kids sit or lie down. Here's a spot, just hold my leg still. Press, click, and hold. Be sure to hear the click. Hold it there for 10 seconds. That's 10 seconds. Always have an extra Epi-Pen ready because the medicine can wear off. Then call 911. Easy, white.
Today, doctors are seeing more and more children with allergies, especially food allergies. In a room of 20 kids, one or more of them will have allergies. While most allergic reactions result in merely uncomfortable symptoms, some anaphylactic reactions may be more serious and even life-threatening. About 150 children and young adults die from food allergies every year in the United States. Due to the unpredictable nature of allergic reactions, over 2.4 million epinephrine autoinjectors, such as this, are currently being prescribed. Epi-Pens deliver medicine quickly and effectively, but they only work if there is somebody around who knows where the pen is, when to use it, how to use it, and will actually do it. Times when you need to use an Epi-Pen can be stressful and may even be life-threatening. So it is important to have a plan of action so you can calmly react to the situation. Knowing when to use an Epi-Pen can be easy. If a child eats something they're allergic to, has hives, and is wheezing, give the shot. Sometimes, however, symptoms may not be as obvious. So if you are in doubt, always give the shot. You may not even have known what the child has eaten. But if you do suspect an allergic reaction, or a child is demonstrating 2 or more symptoms, don't wait. The longer you wait to administer an Epi-Pen, the harder it is to stop an allergic reaction, mild or severe. And allergic reactions can change from mild to fatal quickly. No child has ever died or has had serious problems from a standard dose of epinephrine. To protect the child in your life, be prepared. Memorize these steps and practice them. Review each child's action plan, know where each child's Epi-Pen is, locate it. Epi equals 911. If you get it, call it. Take the Epi-Pen out of its case. Hold it in a firm fist grip. Remove the cap. Make sure the child is sitting or lying down. Identify the big muscle in the thigh. Hold the leg and the child steadily. Press the orange part firmly against the thigh so that it clicks. Stay there. Don't bounce. Hold for 10 seconds. Press, click, and hold. Some of you may have an epinephrine injector that looks like this. This training device has yellow caps, but yours may have a different color. This has the same medicine as the Epi-Pen, the same kind of spring-loaded needle, and is used for exactly the same reasons. This injector has 2 safety caps. Hold the injector in a fist grip. Don't put your thumb on either end. Remove both safety caps. The red end is the action end. That's where the needle comes out. Remember, red to the leg. The red end should not touch anything else. Again, make sure the child is sitting or lying down and hold for 10 seconds. For this device, the needle will remain exposed after use. Please put it down carefully or put it back in the case. And if you haven't done so already, call 911. As with any emergency medication or device, please be familiar with it before you need to use it.
So that's probably the most important thing, is to be familiar with the Epi-Pen and how to use it before the emergency situation happens. During an emergency situation, it's really not a good time to say, oh, how do I use this? What do I do? So if your client has an Epi-Pen, take it out of the medication cabinet, get used to it. The directions are actually right on the side. You probably want to know as much about the situation and the person's history with the allergy as possible. There's probably a story that goes along with it. So the allergy, it could be hornets, it could be bee stings, it could be nuts, it could be milk. You definitely want to avoid the allergy, but what I would want to know is, what is the history here? How did the allergy actually display? The most concerning symptom here is actually airway. So for airway, they can have shortness of breath, difficulty breathing, being unable to swallow. The tongue can swell shut, including the airway, so they wouldn't be able to breathe. That's why they have an Epi-Pen. Other symptoms of anaphylaxis, they could have hives, redness, itching, rash, swelling, cramps, diarrhea, nausea, vomiting. Their blood pressure can drop very quickly. They can have an increased heart rate, a weak pulse. They might get faint and feel like fainting. So it's definitely, you want to watch for any of these signs of anaphylaxis. If you notice any of these signs, you're going to go ahead and give your client the Epi-Pen. In order to do that, you're going to take this blue piece off. Hold this in a firm grip. Don't put your hands over this area. That's the action end. That's where the needle pops out. You don't have to take time to remove the clothes. People tend to think that you have to take the pants off. You don't. You're going to go straight into the upper outer thigh, but watch the seams of the pants. I knew somebody one time, they said they gave the shot in the seam of the pants and they weren't sure whether or not it actually entered the skin. So don't go near the seam of the pants. Go up into the upper outer thigh. Press, click, and hold. Be sure to hear the click. That's the needle popping out. Hold for 10 seconds, release. You can massage the area so that the epinephrine is going faster into the body, and 911 needs to be called. While 911 is getting to the scene, you have to stay with your client, keep them safe, monitor them. If they stop breathing or go into cardiac arrest, this is where your CPR and first aid skills are going to be coming in. If there is a delay in 911 getting to the scene and they have a second Epi-Pen, usually these come in packs of 2, you can go ahead and give a second dose of epinephrine. And always stay with them until EMS comes to the scene. So every Epi-Pen has 1 dose of epinephrine. So if you use the Epi-Pen on your client, then you definitely want to notify the pharmacy and get a new Epi-Pen. This is not a real Epi-Pen, but a real one would have like a dose window and you would be able to see the actual epinephrine. It should be clear. If it was ever cloudy or had particles, you would want to notify the pharmacy because they would need a different Epi-Pen. These do expire, so keep track of that. You should keep track of the expiration date. And these have to be kept at around room temperature. They shouldn't be left like in a car or anything like that. They should be kept at room temperature. Your client might be able to carry this on them independently when they leave the facility, but in order for that to happen, that has to be written on the doctor's order. If that is not written on the doctor's order, you as staff have to remember to take it out of the medication cabinet and carry it on you every time you leave the facility with your client, because you don't know when exposure to that allergen is going to occur. So always remember to take your Epi-Pen with you wherever they go, because you never really know when it's going to happen. So, questions or comments about the Epi-Pen, or how to use it, or anything, or diabetes, or insulin? All right, I think that's it for diabetes, insulin, and the Epi-Pen.